Hey, Johannes here with some more breathing tips. Today, I'm going to chat to you just briefly about blocking the leaks. As we know, as we're well aware by now, carbon dioxide is the gold, right? It's the fizz of life. It's what you want to hold on to. It brings light and life into every single cell, every single molecule that's in your body, and you do not want to lose a single drop of it, right? So, what we're talking about today is how to block the leaks of carbon dioxide that we have. And really, I want to bring one thing to your awareness. So restoring the natural flow of breathing, this process that we're doing, which is a chemical process, right? We're restoring chemistry in the body. It takes a little bit of time. I like to talk about it as you're stretching a band, right? It's like you're slowly and gradually widening and expanding your capacity for having more carbon dioxide in your system. Just like slowly and gradually over time, that's been lowered, right? We're stretching it back out. And sometimes, just like when you stretch a band, it happens in push and pull, right? It's not a linear process. So be mindful of that. Some days you're going to find an amazing acceleration and progression, and then the next day you might have found that it's like, oh, what's going on? But over time, we're looking for gradual improvement. Okay, as you start to increase the amount of carbon dioxide that you have in your lungs and in your blood, which you're doing by breathing less, breathing through the nose, breathing low, breathing slow, right? You are completely rewiring your body's chemistry. And in the beginning, it might want to push back a little bit because it's gotten really comfortable at this low point of carbon dioxide, right? This low sort of baseline marker. And one of the ways that your body will try to sneak off, right, some carbon dioxide is by yawning, sighing, coughing, throat clearing, right, excessive talking, or even just generally mouth breathing, right? So imagine you have a certain set point for carbon dioxide. Now, all of a sudden, on a daily basis, someone is trying to raise that point, right? You have more in your system. You're going to try to bring it back to balance. And especially in these initial phases, you'll notice your body doing this. So you notice that you're yawning a lot, okay? And this is not natural. People shouldn't yawn all the time. It's actually a clear sign of poor breathing habits, okay? But as you can imagine by now, as you start increasing the carbon dioxide, your body might want to yawn more. And so here's a little tip, a little trick for you. Okay, first of all, when you feel a sigh, a yawn, or a cough, or like a sort of this need to clear your throat come up, try to inhibit it, okay? Try to block it. And we're doing that by closing the mouth first of all. Make very sure that the mouth is closed. Then just pause the breath for about 3 seconds. So just stop, take a moment, reassess, become conscious, right? And then gently swallow and place the tongue back in the roof of the mouth in its natural resting position, okay? From there, breathe in and out through the nose and just relax. Relax any bracing and soften the breathing muscles. And even just doing that a couple of times a day regardless will start to make that informal practice formal. It's a way that you can just tune in. But you'll see that sort of need to yawn will come in, right? You'll be like, oh, here we are. Catch it early, stop for a moment, relax, close the mouth, tongue in the roof, and just breathe in through the nose and even pause the breath for about 3 seconds. And what will most likely happen is by you making it conscious, the urge will pause, okay? Now, if you do find that you yawn, if you do catch yourself going, and sometimes it can be unconscious, you know what I mean? One thing to do as well with yawning is try and do it through your nose. Now, this sounds super weird, but you could actually yawn through your nose, absolutely. Or you can open your mouth, it doesn't have to look so strange, but still breathe in through your nose. Try. It's a skill, I know. I've lots of practice here, so don't be, takes time, but you'll get it. You will. But if you do find yourself yawning, coughing, sighing, throat clearing, any leak of carbon dioxide, if it happens, if you breathe through your mouth for a moment, you can always compensate. So what it looks like is your breathing has a normal rate. Your body will try to increase breathing by doing something like a yawn. afterwards, when you catch yourself, close your mouth for a moment, tongue in the roof, relax, and hold your breath for about 3 seconds. Do a small breath hold, and that will stabilize the carbon dioxide levels again. Okay? So, 2 things you can do. One of them is try to prevent those responses. And of course, by becoming aware of it, awareness is transformative in and of itself. You will most likely catch it early. But if it does happen, if you find yourself yawning, and just a little tip to take away as well, just pause the breathing afterwards for a few seconds. Right? Imagine you've lost some carbon dioxide, hold for a moment, and let it come back to baseline, just so we block any of those leaks and we hold on to the gold, especially during this time when we're, changing. We're fundamentally rewiring our brain and our breathing. And so we just have to be mindful of any leaks, block them early, and we're on top of it. You're doing amazing. See you on the other side.